So sorry, do you hear me now?
Yes, please. We can hear you now.
Yes, there's going to be a technological challenge from here, and so I'll do the introduction very quickly. Okay. In case it goes off, I've sent it to James, and then you can continue. We are privileged today to also have someone I've come to know only recently, and I contacted him, and he immediately joined the association. He's called Mr. Williams Kwara, who attended Navrongo Senior Secondary School. He had his BSc in Applied Biology at the University for Development Studies. He continued to have his master's in public health, majoring in epidemiology and disease control from the University of Ghana, and then had an MSc in global health policy and management, economics and analytics at the Brandeis University in USA. He's passionate about leveraging technology and data analytics to improve health outcomes. He has worked on several public health interventions in Ghana, including MOTEC, Community Health Nurse and the GO, MEPSI in the public and private.
Okay. So then I'll continue from here. He currently works with PATH as the M&E and data manager, and is a member of the Ghana.
Yes, I'm almost done. He currently works with the PATH as the M&E and data manager, and as I've said, he's a member of the Ghana Public Health Association. Ladies and gentlemen, we are privileged to have Mr. Williams Kwara, my co-worker at PATH, to chair the session for today. Williams, over to you.
Yes. Yeah, thank you very much, Dr. Mofa, and good evening to everyone. I'm deeply honored to be asked to share this particular important session. So when I was contacted yesterday, the first thing that came to mind was, why me? I'm quite new, and we have well-experienced people on this platform. Why me? But then I began to think about it, and I realized the motive of this particular platform is to also nurture the younger ones to grow to be like the senior colleagues on this platform, which is a great honor done me. So I'm deeply honored to be asked to share this particular session. And I'm only going to be holding the steering wheel, and I urge all of us who would be the engine and ties of this particular discussion to help me steer the affairs of this particular meeting to a successful end. So at this point, I'm happy and I accept to chair, to sit in front and make sure that we are able to drive this bus to a successful destination this evening. Thank you very much.
Thank you very much, Mr. Kwara, for accepting to chair. On the program, you are supposed to please introduce our speaker. So if you can do that now.
All right, thank you very much. So today our topic for today's discussion is zoonotic diseases and pandemics. And we currently know what we are confronted with, a pandemic, of course, and we would want to learn more about what these pandemics are and what the relationship is between zoonotic diseases and pandemics. So today we are going to be privileged to be well educated and provided information that we need on this particular topic. Our speaker is somebody who attended Infantsima Girls Secondary School, has an MPhil in Applied Epidemiology and Disease Control through the Ghana Field Epidemiology and Laboratory Training Program. She has a doctorate in veterinary medicine from the Veterinary Faculty, University of Zagreb in Croatia. She has worked with the Ministry of Food and Agri for the past 22 years. She is the Commonwealth Veterinary Representative for Ghana and World Animal Health Organization focal point for communication, Ghana. She was the Vice President of the Ghana Veterinary Medical Association. She has undertaken various assignments on the continent, served as a part-time lecturer on the GFELTP, where she taught veterinary epidemiology. She's currently with Mott MacDonald as a regional One Health specialist, the Fleming Fund, West Africa, and she is a strong member of our dear association, Ghana Public Health Association. Please help me welcome our speaker, our guest speaker today's evening session, Dr. Perdita Hilary Lopes. So Dr. Lopes, your audience, your guest speaker.
Okay. Yes, thank you so much, Mr. Chairman, Mr. Aquara. It's indeed an honor to be given the opportunity to talk about zoonosis pandemics. I've added a little more risk reduction because we can't just talk about zoonosis and pandemics and just leave it at that, being the public health specialist that we are. So briefly, let me see, yeah. So do you see my slide, please?
Yes, I see your slide.
The second one is outline of presentation. Is it? I just want to confirm that it's showing for everyone, or are we still on the front page?
Okay, so I'm still on the front page.
Oh,
do we have everybody follow?
Yes,
Yeah. Yes,
we
we
are
are
still
following.
on the front page.
Okay.
So just tell me when we get to, because I don't know if it's technology issues here. Let me see slideshow. Okay.
So because you are on slideshow, the screen that you are showing must be active for your cursor to work for you.
Yeah. Let me click on slideshow again. Let me see this one, slideshow. Okay. Oh dear. Okay. No, what's going on? Technology, please bear with me. This is just so.
So another
easy
thing to do. Another easy thing to do is just press Control Tab, and then
Control Tab.
Yeah, the screen.
And then
highlight the screen that you want to share.
Okay. Yeah. So Control and Tab, and then I highlight the screen. Has it come? Outline.
Okay, I haven't seen. Try moving the slides and let's see. Nope, it's not responding.
Oh dear. This is just so. Sorry.
Okay. So you can start all over and let's see. Let's just spend a minute or two for you to just start over and let's see.
So I'm just clicking on the resume slideshow, and I've been at this since morning, and it's just ridiculous.
Yeah. So I think what is happening is the slide that is on share is not active.
Okay.
That is why.
Do we see definitions?
No.
Oh dear. Then there must be something. Let me see. Home. Oh dear. Slide. Outline. So maybe I need to share my presentation with James and he can present or something. Okay, I've seen something at the top here. Let me click on it and see. Is it coming? Slideshow. This is just unfortunate.
Yeah, we have the slide, the first one, but it's not moving. Okay, is it possible whilst you're trying a test, you can share your slides with James so he can.
I think I better do that. Yes, I better do that. James, kindly quickly give me your email because I don't have you on this computer. New mail. James, can I have your email, please?
Okay, I'm going to send it to you now.
Okay, okay. No, just tell me. I'll type it in.
Yes, I can, please.
Okay, that's fine.
So whilst that is happening, I'd like to apologize to everybody online that please bear with us. Technology can sometimes be frustrating, and we would start immediately. James gets the slides and we should be set to go. So please accept our apologies.
James, I'm waiting for your email, if you can. Yeah.
I've sent it to you. Check the chat. I've sent it to you right now.
Chat. Please, can you check if you have an outline of presentation now?
Yes, I have seen that.
Okay, so I think that I'll do it like this. But okay, so this is going to be, we've wasted enough time. So briefly, we're going to talk about some few definitions and then give a brief introduction to the lecture, how zoonosis diseases are transmitted, the public health impact. There are some driving forces which enhance zoonotic disease transmission. Risk factors, we'll talk about the risk factors, control strategies, partnerships, and then we get to the conclusion. Okay, so being public health people, I think most of us or most of you are probably conversant with the concept of zoonosis, but for those who are not, a zoonosis is a disease that is transmitted from animals to humans. And most of the times, zoonoses are diseases which occur naturally in animals. It means human beings, we don't have these diseases. However, it is possible for human beings to contract diseases, these zoonotic diseases from animals. And it's important to stress here that most zoonotic diseases are not well adapted for human to human transmission. We have also the concept of emerging zoonoses. You have zoonotic diseases which are common to particular geographic areas, but from time to time we see new zoonotic diseases emerging in different geographic areas. So, we see an increase in the numbers which used to be. So we call these emerging zoonotic diseases. So it means there's an increase in the incidence of the disease over a certain period of time or over a geographic area. Then the concept of pandemics comes in, and as well its public health implications. Usually when we talk of pandemics, we have epidemics. Epidemics are usually localized in nature, infectious disease outbreaks in a local geographic area. But when we talk about pandemics, it's the same epidemics, but just that this time, there are large-scale outbreaks of infectious diseases, and they're spanning much bigger geographical areas. They cross international borders with huge morbidity and mortalities associated with them and causing significant economic, social, and political disruption. We know what is happening with the COVID now all over different countries. So many things are happening. So again, we'll talk about that later. The confluence, by way of introduction, of human and animal disease is not really a new phenomenon. It's something we've known for so many years. However, the scale, scope, and global impact has no historical precedent. Previously, we used to hear about pandemics from books, university textbooks and all that, but currently nobody alive can tell me that they haven't experienced the impact of COVID-19. So for that matter, the scale and global impact is not lost on anybody who is alive now, be you a child, be you an adult. I would like to emphasize here that about 73% of human pathogens are zoonotic. And out of these 75%, about 75% are emerging diseases over the last 20 years, which have a wildlife source. Most pandemics also have originated from zoonotic transmission of diseases from animals to human beings. Certain factors come together to encourage the occurrence of zoonotic diseases or emerging and re-emerging diseases. And it's likely to continue. The way we live our lifestyles, these things are likely to continue with profound implications, both for human populations as well as animal populations. And it's interesting to note that vets were finding more antibiotic-resistant pathogens like certain species of Salmonella species. In human medicine, you have the MRSA, methicillin-resistant species due to pathogens changing over time, building up resistance. So both zoonotic diseases and pandemics are basically like wildfires when they occur. They come unexpected, and the ramifications are such that it throws everything into a pandemonium. People are running helter-skelter, trying to find how to arrest the situation, such that the economic burden is very, very high on national systems. Let's first of all understand how zoonosis occur, or pandemics. Initially, we have the stage where pathogens are exclusively present in animal populations, but then due to human beings interacting with the ecosystem, human beings going into animal ecosystems, you have pathogens being transferred between humans and animals. And because of continued interactions, these pathogens sometimes are able to jump the species barrier from animals into the human population. And then when there's sustained transmission, you have these pathogens being transferred exclusively between human beings. So the factors which are interplaying for zoonotic disease transmission, we have the animal-human interface, companion animal ownerships. We use animals as food, husbandry practices, going to the farm, coming from the farm, bushmeat hunting, habitat encroachment. Now we're building new urbanization, all rural areas are all being encroached upon, and we are cutting down our trees and our forests. So we're encroaching into animal territory. So pathogens which were exclusive to that ecosystem are gradually coming closer to human systems. Within the human domain as well, our behavior and attitudes, our preferences, culture, lifestyle, and so many other things are all having an effect on how we are interacting with the environment. And all these are leading to disease emergence and re-emergence, even to the extent that they persist in the environment. So it's an interplay of all these things. There are some driving forces which encourage zoonotic disease occurrence. Some of these are, you know, at the pathogen level, at the host level, vector level, and some other ecological determinants. Let me reduce this thing from here. Yeah, at the pathogen level, we have microbial adaptation. Viruses, let's say viruses or bacteria, they adapt, they mutate over years due to maybe antibiotic resistance. They mutate because they've come into contact with other viruses, and then they exchange genetic material. So there's antigenic drift, and you know, they change their host range, and therefore are able to be more resistant to antimicrobial therapy. When this happens, it means that we're seeing new diseases occurring. Human behavior, such as bushmeat hunting, as I mentioned earlier, deforestation, bushmeat hunting, we can cite Ebola. Hitherto it was in Central and other Eastern Africa, but we have experienced Ebola in West Africa, I think in 2014, because more and more people are going into the bush, hunting pangolins, deer, and what have you, farming and trading of live wild animals. If you go to Kumasi market, for instance, there's a lot of bushmeat market activities going on, but particularly so in Asian countries, all these are going on, you know, it's their way of life. So close and repeated contact with infected animals is bringing us closer and closer into animal domain, driving diverse wildlife species together and pushing livestock, domestic livestock, into overlapping environments, therefore facilitating the transfer of novel agents into naive and susceptible species. Other examples can be the building of dams, which can favor, let's say, the proliferation of mosquitoes. Sometimes the pathogen itself may become more virulent or better adapted to humans. Livestock production systems. If you look at developed countries, for instance, they have the intensive livestock production systems. This means more or less you're reducing the biodiversity. Instead of allowing animals to mate naturally, you have like some, you know, you're controlling the breeding, so it becomes like a monoculture. The genetic pool is very limited, and once you limit the biodiversity, it means you are increasing the chances of animals falling sick or contracting new diseases, as we had, for instance, in bovine spongiform encephalopathy some years back, and other similar diseases. Avian influenza in recent times is also an example of intensive poultry farming. In East Africa, there's also an example of Nipah virus outbreaks in Malaysia and Singapore, just because wild bats and domestic swine were coming more into closer contact. And so once these domestic swines were able to get the Nipah virus, it means automatically human beings who are handling them are also going to get these diseases. Changes in human demographics and behavior. As I mentioned earlier, urbanization, a lot of people, rural-urban drift. So people are shifting from the rural areas to urban areas. It means there's going to be more demands on services in the urban centers. There's going to be congestion, you know, limited higher population densities and all that. All this means that you're going to have easier spread of diseases or outbreaks when they do occur. International travel and commerce has actually made the world a global village, and within, you know, within a few hours, you can actually move from one continent to the other. There is this concept, you know, I heard somewhere they mentioned about 72 hours, like you can go actually around the whole world. So imagine you were going around the whole world within 72 hours, which is like 3 days. It means one disease can actually travel around the whole world within 3 days. And COVID has actually shown us that this is not a far-fetched theory. Other driving forces, which may not be immediately obvious to some of us, for instance, differences in disease diagnosis approaches, in that, let's say, human medicine is doing its own thing, animal medicine is doing its own thing, environmental health is also doing its own thing, when in actual fact, we should all be using the same approaches in trying to look at pathogens of common interest from the environment, animal sector, human health sector, and how they are all interconnected or intertwined. And quite apart from that, the communication lines are very limited. So because we're not talking to each other, it means there's very little comparison of microbial populations in animals and humans. Why am I emphasizing this? It means that when something is happening in one sector, or maybe whether animal or human or environment, because we're not communicating, the same thing may be happening in a different sector. So we are unable to alert the other that this is what is happening. And for that matter, we need to all be alert and work towards a common purpose. We also have ecological determinants such as climate change, due to excessive burning of fossil fuels, deforestation, mechanized agriculture, greenhouse effect. And as a matter of fact, climate change is one of the most significant factors influencing the emergence and re-emergence of zoonotic diseases. For most zoonotic diseases, there usually is a small number of host species that act as a reservoir for the infection. We can cite some specific zoonotic diseases depending on the source. We have like arthropod-borne diseases such as yellow fever or the hemorrhagic fevers, Ebola bats, African, which originates from bats and African apes, gastrointestinal salmonella species, and respiratory influenzas, for which we have different types like avian influenza, H5N1, H1N1. For those of pandemic potential, we have the respiratory ones like SARS coronavirus, which spread to about 30 countries on 6 continents within a few months of the initial outbreak. There was also the Middle East respiratory syndrome and influenza, various types of influenza, avian influenza outbreaks on the continent. So currently our public enemy number 1, the corona SARS-CoV-2, which has been named by the WHO as COVID-19. And this was thought to have originated from Wuhan, from a live animal market, as we mentioned earlier. In certain cultures, which is similar to Ghana, really, they have a lot of animals being sold at live bird markets. And just imagine the sheer number of people who come in there and go. These people are going to the forest, some are going to their home. So it's like a melting pot of pathogens coming from various areas and going to various areas. And this is what is thought to have triggered, or this is where the COVID-19 is thought to have started. It's still not been proven. Of course, there are those who think that it was lab manufactured, but of course, it hasn't been proven yet. So what are the risk factors for zoonotic disease emergence? We have the primary risk factors, which may result in the transfer of disease from one species to another. And then we have the amplification factors, which actually affect the magnitude of the resulting impacts. For pandemics, for pandemic diseases, we talk about the spark risks. That is, where is it more likely for us to see a pandemic occur? You know, so understandably, pandemics are more likely, given the reasons we stated earlier, deforestation, cultural practices of human beings, consumption of bushmeat, trading in live animals, live animal markets, and all that. So these areas are like spark areas for pandemics to occur. And once they do occur, then of course, we have the spread risk. The spread risk is talking about how likely it is that a disease can quickly spread from its initial focus where it happened. And this can be influenced by the pathogen-specific factors, or it can also be influenced by human population, let's say population density. It can be influenced by comorbidities, malnutrition, the immune system of the person or of the populations that are being affected. There is something called probabilistic modeling and analytical tools, and these are used to plot how or assess how pandemics can be, how quickly they can spread and how devastating they can be. And this also depends on genetic adaptation and the mode of transmission. If a disease is transmitted by respiratory means, we know how quickly it spreads. If a disease is spread through contact, of course, it means that if you can limit contact between infected and uninfected populations, the disease is going to spread much slower than a disease which is spreading through respiratory means. So on that basis, we may have group 1 pandemics, that is those with high potential pandemic, potential, such as the influenza viruses. And the EP analysis indicates that in any given year, about 1% probability exists that influenza pandemics can cause almost 6 million pneumonia and influenza deaths globally. And the problem with these influenza virus diseases are that a lot of people remain asymptomatic. And once they are asymptomatic, it means they're spreading disease all over and they go undetected. And by the time you are detecting that they are affected, a lot more people have been exposed or infected. So that makes them very, very dangerous. The group 2 pandemics relate to those who have no demonstrated human-to-human transmission. However, this transmission is possible because of genetic mutations and adaptations of the virus. So in this category, we have Nipah viruses, H5N1, H7N9. And group 3 pandemics, they have the potential to cause regional or interregional pandemics due to the slow pace of transmission, such as Ebola, Lassa, and Marburg. Historically, there have been a number of pandemics in the 21st century, but even before the 21st century, there have been a lot of pandemics in China, in Asia, in South America, but in recent times, ones that we can refer to easily, the Spanish flu in 1918, where almost about 50 million people died, the Asian flu of H2N2 in 1956 to 1957 to 58 with about 4 million deaths, and same for the Hong Kong flu. So how do we mitigate pandemics or zoonosis for that matter? There is a need for preparedness initiatives. We don't need as a country or as a region, West Africa, or as a continent to wait for pandemics to occur before we take action. There's the need to always be in a state of preparedness. There's the need to invest in the public health sector. If you all recall, when we had the COVID, the president said, we're giving free water, we're giving, electricity. Well, to some extent that helps, but I think most importantly is to say that we're giving free water. And I wouldn't see that as a political gimmick, and this is not a political slogan, but water is so basic to sanitation. We need water to sanitize our hands. Imagine there are people who were not able to afford to clean themselves, and we have this COVID all over the place. So I think that was a good initiative. Also very important is the fact that there was increased situational awareness of how the disease is occurring, of how to avoid it, of how to sanitize yourself, of what to do even when you are exposed. So all these are very, very important to mitigating the situation. And then of course, what were the steps which were taken to quickly extinguish or diminish the situation? So acting rapidly is equally important. And then once the pandemic starts, there's the need for a coordinated response. There's the need for clear leadership. There's the need for cooperation and collaboration so that we can all coordinate our efforts to get the best impact out of a response. So public health messaging is very important to the reduction of transmission. And of course, very importantly, is also care and treatment of the ill. Care and treatment of the ill means drugs should be available, means quarantine facilities should be available, not that somebody is ill, so we just leave them to fend for themselves. Care and treatment of the ill, or even for those who are diseased, how are we disposing of them so that we are not spreading infection further? All that is very, very important. And then another concept which I think is worth mentioning is something called the surge capacity. That is the ability of any country to scale up the delivery of health interventions, which is proportionate to the events or severity of an event or pathogen or population at risk. When we had the corona outbreak, I think some of the issues which came up, some of the first issues which came up was accessibility to face masks. Face masks which used to be just, used in hospital environments, all of a sudden were needed in the streets. But the supply was not there, and people became reach overnight just because we didn't have adequate face masks, supply and demand. We didn't have adequate face masks for the population until much later. You know, more face masks came into the system, and now a lot more people can have access to it. Hand sanitizers, people couldn't have access to hand sanitizers. What is our transport systems? How are transport systems like? So because of this, there had to be lockdowns so that people can sit at home and health officials can strategize how best we can all address the situation. So basically, the role of vets in zoonotics and pandemic risk reduction is that usually vets are a very important source of information so far as zoonotic diseases are concerned. So that's where the One Health concept comes in, because what they see, they should be able to share freely with their health counterparts and alert them that this is what we are seeing in our clinics now. This is what we are seeing in the food animals. This is what we are seeing in the meats that are being imported into the country. And then humans can also be alerted to take the necessary actions. That is not to say that a vet is supposed to treat human beings. That is for the medical doctor or physician to attend to humans who are sick. One important factor, though we've talked about it earlier, but I just want to touch slightly on it because it plays a very, very important role in pandemics. Now, when I'm talking about zoonosis, I'm using it interchangeably with pandemics because they are more or less interrelated. Most of the pandemics are zoonotic in origin. So climate change helps to create the conditions which favor increases in zoonotic diseases. Some can be waterborne, foodborne, vector-borne, and also heat stress. Also increased veterinary drug residues in animal products. Because of climate change, it means animals are what? Are not responding to treatment as they used to before. Influence of geoclimatic change on zoonotic disease epidemiology, and this can be evidenced by reservoirs and vector dynamics. Climate change is also creating new niches for vectors because the spatial and temporal distribution of all these vectors or animals and hosts are changing. If we haven't scorching heats in the savannah, cattle have to be moved inward into Ghana, into greener pastures. So it means what? People are moving, vectors are moving, cattle are moving, they are coming with ticks, they are coming with new diseases. The cattle are not coming alone, they come in with human beings who live in a different geographical or spatial location. So as they move, diseases are moving with them. Climate change is changing the migratory patterns of birds and other wildlife. We all know that during the winter, birds move from temperate zones to hotter zones to more hotter countries such as Africa to come and feed, and then they go back. So in moving in and out, they move with diseases. And the typical example is when we have the avian influenza outbreaks in Africa. And then, of course, changes in animal husbandry practices in response to natural disasters. So all these basically are to do with climate change and how it affects disease transmission or disease dynamics. Rainfall, for example, when you have dense vegetation after rainfall, it means there's more shelter and nesting grounds for vectors. We all know that in the rainy season, we are more likely to see more snails In the rainy season, we're more likely to see more mosquitoes. You know, if there are more mosquitoes, if there are vectors which feed on mosquitoes, it means they are also going to increase in number because they have what to feed on. If there are more snails, vectors which feed on snails are going to increase in number. So all these affect disease transmission within human populations. Increased crops means rodent populations and rodent-borne zoonosis are all going to increase. When we have flooding, we all know, I think in the rainy season in Ghana, for instance, there's a lot of cholera outbreaks and all that, because sometimes the quality of drinking water may be affected. People may be displaced during the rainy season, and they are very stressful, so which means they're going to be more susceptible to zoonotic diseases. There are other extreme weather events which may not be prevalent in our part of the world, but there is a phenomenon called El Nino Southern Oscillation, and this also contributes to increased weather events in other parts of the world, leading to increase in vectors. But I think the most important challenge to zoonosis and their control is the fact that we may have public health systems that are inadequately resourced, or even if they are resourced, maybe they are ill-prepared. Do we have the trained personnel? Or sometimes we have the personnel. I don't doubt that we have people, but are they trained in specific areas to respond in specific ways? Are they evenly distributed over the country? Is there equity in the distribution of health personnel over the country, over the region, so that if there's a problem, people can quickly rise up and address it? Do we have a coordinated surveillance system within the Africa region? Right now, we have to look within ourselves to find our own responses to disease outbreaks. We can't wait for somebody to come and save us. So within our own region, do we have a coordinated response to disease outbreaks? It's very important to be able to detect early and accurately the threat of new outbreaks in order to be able to address them. So there should be some systems in place for us to predict that diseases are likely to occur in certain areas. I think that's why we have surveillance systems in place in every country. So surveillance must be ongoing, not just the passive surveillance, but active surveillance, syndromic surveillance, whatever form of surveillance that there is, you know, so that we are on top of our game and are able to detect diseases very quickly in order to be able to respond and control them. So for some of the tools or systems available for surveillance, they have the famine early warning systems. That is in certain areas when you see that there is famine or there are indications of famine going to occur. You know what occurs when there is famine in a region, you know, people are not having enough food to eat. So what is going to happen? People are going to move in droves. So it means there's going to be population movements. So all these are indications of impending outbreaks, whether zoonotic or pandemics, because if people are moving from one region, mass movement from one region to another in search of food, or in search of greener pastures, both for livestock or crops, then it means you're going to have movement of disease across regions or geographical boundaries. So in this regard, bodies, international partners like the FAO, the World Animal Health organization. So FAO being for the Food, World Animal Health, and WHO, they work together. They work in synergy, actually, to monitor some of these early warning systems, you know, to read what is on the horizon so far as outbreaks, pandemics, zoonotic outbreaks are concerned. There is satellite remote sensing of land surface conditions, predictive mathematical modeling systems are in place for disease transmission dynamics and control, and several other methods for reducing zoonosis, incidence mapping, contact tracing, communication, public health campaigns, and other simple strategies which we are all used to on a daily basis, trying to eliminate the pathogen from its animal reservoirs. An example would be rabies, for instance. You're supposed to ensure that your animals are not, you're not taking them bush hunting. If your dogs stay indoors and are not mixing with unvaccinated dogs, or they are not roaming the streets, they're not likely to bring you rabies, for instance. You need to reduce contact between the potential agent and the susceptible host. And then, of course, increasing the host resistance, consumer initiatives, protection initiatives, domestic animal identification, maintain animal health, care of pregnant, immunosuppressed people, children, suspect and stray animals, control of pest animals, and all these things. So the big question, or the million-dollar question, is the approach to handling pandemics or zoonotics. Because from zoonotics, you go to pandemics. Should the approach be curative or preventive? Do we wait for the thing to happen and then we try to deal with it, or we try to prevent it? And so for that reason, there's the need for partnership between veterinary public health, human public health, and I think we need to add here as well, and environmental health. There needs to be partnerships between all these agencies in country, with external collaborators and all that. There's also the need for syndromic surveillance of both humans and animals. Again, environment must not be excluded in this endeavor. So representative of populations under surveillance, sometimes we have surveillance sites. There's a need to detect unusual clusters of morbidity and mortality, and all these should be species, region, and disease specific, and based on sentinel surveillance. We need to focus on specific syndromes. Are we focusing on what are we seeing in the clinics? Increase in gastrointestinal syndromes, increase in respiratory syndromes, or reproductive tracts, central nervous system? No, whatever it is that we are seeing at the clinics, we should be able to pick it up very quickly using both passive and active surveillance. And all these things should be independent of government political interests. That is why we have the Ghana Public Health Association. There's also the need for active structured lab-based diagnosis of diseased humans and animals. The role of the lab in disease surveillance and control cannot be overemphasized. And then surveillance of active animals, whether through serology or agent detection. So the approach should be a one health, a one medicine, and one world approach, that we all live together and our destinies are intertwined. we need to ensure that the channels of communication are open. This channel should include all regulatory agencies, national reference labs, livestock producers, human health hospitals, international agencies, donors or donor agencies, yeah, FAO, WHO. There are so many other NGOs out there who are all on the health scene and supporting to ensure that we are able to control zoonosis and pandemics. Animal and human health data should be integrated, and there's the need for intersectoral committees for zoonosis preparedness and control. And veterinary public health officers should be well-resourced and motivated. And inexpensive, sensitive, and specific rapid diagnostic tests should be available for field situations. Right now, we have the COVID. I think, I don't know how testing is accessible to most Ghanaians. The last time I tried to go for testing, I think I was asked to pay almost 500 Ghana. Elsewhere, it may be about 300 Ghana. But how many people are able to pay for that? And then, of course, individual or herd immunity, different ways of preventing infections, but these are more at individual levels. Of course, vaccination, if you're vaccinating a population, then you are increasing the herd immunity. And so you're protecting the whole population, if you like. People must learn to boil their water in areas where they don't have access to potable water. And most importantly, avoiding crowds during epidemics and pandemics. For Corona, we've all learned, we've learned by doing. A lot of people initially were reluctant to go out into public places, only 25 people at funerals and what have you. But now, even when we have to go out, we know that we must use protection in public places. So at the local, national, and international level, what are we doing to control pandemics? These are some of the activities that can be done to control pandemics. So basically, to sum it up, One Health is a collaborative effort of multiple disciplines working locally, nationally, and globally to attain optimum health for people, animals, plants, and our environment. We all have to work together to make sure that to make sure that diseases in our environment are being prevented or are being kept under control. And the approach, once again, is through national support, intersectoral approach, individual commitment, and it will be a better place for all of us. So that's how zoonosis and pandemics are related. Thank you so much for your attention.
Oh. Wow.
Thank you very much.
Yes. Thank you very much, Doc, for this well-elaborate, very detailed presentation. In fact, I have learned a lot of things, and I'm sure majority of us have learned a lot of new things. So at this point, we would like to take a couple of questions. So first, if you have questions, please just put them in the chat box, and then we would get to that. So I would first of all will just seize this opportunity to just ask the first question as the chairperson. So we've been talking about zoonosis and then pandemics. And my simple question is, all of the time when these things come up, we are thinking about the impacts, the negative impacts we've had. Have there been any instances in history where genes cross over from the animal kingdom into the human kingdom, and then this cross was a positive one? So instead of it killing us, it was actually helping us building some sort of resistance. Has there been any instances like that in history?
You want me to respond or you take more questions? Okay, so while they are preparing more questions, I think I can respond to that. Honestly, I'm not aware of any such instance. Unless you're aware of any such instance, I'm not really aware of any such positive. You know why? I think every organism has its own, you know, genome for a specific reason. That's what makes that organism unique. You know, so if there's any exchange of genetic material, that could be kind of tricky. What do you think?
Yeah, I think maybe there could be some research around that area. Maybe I don't know how they would.
Yes.
There could be
yes,
some.
that could be a bit tricky. Yes.
Yeah, because I just raised this, recognizing the fact that as we fight this malaria stuff, they're done trying to genetically modify mosquitoes to be able to use those ones to sterilize the majority out there, such that you can still have the mosquitoes there, but then they can give you malaria. So,
so here, what you're doing is a controlled. It's a controlled activity, if you like. You know, you deliberately going out to take certain traits you're interested in to breed. You understand?
Yep.
Maybe to give you mosquitoes, which will end up not giving you mosquitoes. So this is a deliberate act, but. Otherwise, then it means you're talking about genetic selection, which is evolution. And of course, as we go, if it's a natural occurrence, then it's genetic, selection. The weaker genes get kind of die out of the system, and the stronger genes come up and stay, which is, I think, a different topic. Yeah.
Thank you very much. So I will move on to the chat box, and I have the first question here from Dr. Georgia Mofa. His question is, it appears mass vaccination of dogs against rabies has gone down. Why is this the case, and what is being done?
Wow. Yeah, for mass vaccination of dogs, if I think it's a problem of funding. You know, the rabies vaccine in itself doesn't really cost much. Because we've been used to mass vaccination for some time, once government does not commit money to it, then it's like people are reluctant to vaccinate by themselves. Let me take the opportunity, for instance, when I used to be in the ministry, Ghana West, for instance, if you get an MCU who is understanding, then they commit money to vaccinate dogs within maybe that geographical area. But then you realize that the districts or municipalities have no clear-cut boundaries. They overlap with joining boundaries. So if you vaccinate in one area and it's not done nationwide, more or less, the effect is kind of very, very, limited. The effect is limited. So as to why there are no more mass vaccinations, I think it's just a question of political will or funding to address it, because rabies is not something that government cannot fund to get rid of rabies in the country. If they do it annually for 5 years and commit money to it, I think government would be doing Ghanaians a big service.
Thank you very much. So we have questions coming up, and James Gamore's question is, what frantic efforts are being made to bring all disciplines onto the common boat in preparedness towards any pandemics so that there will be teamwork rather than individual play?
What efforts are being made to bring all the stakeholders
On board.
On board, so that's the question. I think I must say that for now, Ghana, we're not doing badly, even as a start or as a response to this question. That's why we have the Ghana Public Health Association. You see that we are from so many different disciplines and everybody is playing their part. But I can personally say that there's a lot of collaboration between the Ghana Health Service and the veterinary services, and I think the, what do you call it, environment as well, you know. And then of course we have the GFELT, which is training a lot of specialists. They're training not just low caliber staff, but medics who have already specialized in their own area of expertise, and yet they are all being given the skills with the One Health, from the One Health perspective, that there's the need to collaborate. So I am personally aware that when there have been outbreaks, teams have been drawn from, you know, all these sectors to work together for the common good. So if this can also be achieved at the governance level, if, you know, we could have a One Health Secretariat, you know, funded, supported to be proactive in thinking about, you know, health interventions for this country, instead of it being politics all the time. Ghana, we would go a very long way. So that's, thank you very much for that question.
Great, thank you very much. So Godwin Afenya Edo, I think more of this is like a comment. So he says, surveillance is great, but greater is the capacity to respond to surveillance information. Our pandemic preparedness appear to stop at data management. We need advocacy to fund preparedness to respond, with emphasis to respond to likely pandemic, even within the donor support. And then the other question that comes up here is, our presenter classifies zoonotic diseases as those transmitted from animals to humans. How about vice versa? How would you classify them?
Yeah, yeah, actually that happens as well. You know, that happens from time to time. So we say reverse zoonosis. We say reverse zoonosis for that. But usually if you say zoonosis, it's from animals to humans. So when it does happen, you know, from humans to animals, then we call it reverse zoonosis.
And when we say animals to humans, do we include insects to humans too, as part of the zoonosis?
Insects are animals, fish are animals, you know. Yeah. We do have, like, for instance, M. bovis, which is mainly in cattle, but once in a while, humans do get M. bovis as well. So they may be treated for so long with for M. tuberculosis, and you may not be getting a response. So if you look further, you might realize that you're actually dealing with M. bovis, Mycobacterium bovis. So it happens, it can happen, yeah. Great. Yeah, the capacity to respond to capacity and advocacy for surveillance data, right? I think that was Godwin's question. Yes, so it's good to, yeah, that's a very good question. Yes, it's good to have all the surveillance information and all that. So if you realize, I mentioned that the governance aspect, we probably need to strengthen that in Ghana, so that all the surveillance data that is coming from the field can be channeled to the decision makers at the top for them to implement, because this is what our scientists in the field are finding. This is what they're coming out with. and the politicians or the decision makers should take it and roll with it, so that we don't wait for situations to get out of hand before we use that far fighting approach to tackle them. So yes, it's good to make use of the surveillance data, and I would want to also underline advocacy, that we need to play a very, very important advocacy in disease control in the country. And again, I think the Ghana Public Health Association stands in a very good position to play this role. Thank you. Yeah.
Thank you. Yeah, so we have another question from Godwin, and he starts. So information sharing is key in intersectoral collaboration. Are there existing platforms for information sharing linked between the health information system of the veterinary and the DIMS, the District Health Information Management System, at the district level?
At the district level, I think so. I should think so. I think it starts at the district level. Most of them have this, do they call it district health committees, right? Where at least in the districts that I have worked in, I've always been very proactive in One Health initiative. So the districts that I have worked in, I know they have One Health committees, and you have this intersectoral collaboration. So they do meet on a monthly basis and share information. They share information on maybe diarrheal diseases in the district, maybe other animal health pathogens in the district, whatever, sometimes Borrelia ulcer, whatever it is, they do meet as a group and share this information. But beyond the district level, I think, as I mentioned earlier, I'm aware that this now, over the past few years, maybe 5-8 years, there's been a lot of collaboration between the Ghana Health Service and these other sectors. And a lot is being done in terms of One Health initiatives, or One Health approach to combating disease in Ghana, and I'm quite encouraged by that.
Yeah, thank you very much. So I have two questions here. Alberta, thank you again for coming back. Is malaria a zoonotic disease based on the definition? And then we have another question. I'm taking two at a time. So the other question is from Saba Michael. He says, who are those responsible for bringing the stakeholders together? And I think you are referring to the collaboration that the speaker has been talking about. So two questions here. Is malaria a zoonotic disease based on the definition? And who are those responsible for bringing the stakeholders together to collaborate?
Who are the stakeholders? Is malaria a zoonotic disease by definition? What do you think? It should be.
It should. It is.
Pardon?
So for me, reading the literature, malaria.
Malaria is not. Malaria is not a zoonotic disease. It's not. You know, if you follow lectures, we say that the malaria parasite uses. It doesn't cause the disease in the. What do you call it? In the mosquito itself. The mosquito is just a vector, right? So I'm not quite sure malaria would.
Yeah, so I think the definition she's trying to refer to is we have the vectors that are carrying these pathogens. Yeah. And once this pathogen crosses onto the human host, it causes disease. So you have mosquitoes carrying the pathogen, that's a malaria parasite. And then once the mosquito bites the human being and passes this pathogen onto the human being, it causes malaria. So does that qualify as a zoonosis?
I'm not quite sure.
Okay, so Alberta, this is more research for us, and once we look at the literature, we'll have a much.
Yes.
Yes. Another question is, who is responsible to bring together all the
malaria? I think malaria is a zoonosis. Yes. Yes, it should be a zoonosis. Yeah. Just like Zika, it should be a zoonosis. Yeah.
Okay. Let's talk about collaboration. Who do you think should be responsible for bringing all the different stakeholders together?
For malaria control, who should be responsible?
Who should be responsible? And I think the questioner is referring to the importance of collaboration to be able to address zoonosis and pandemics. As you indicated, different stakeholders. So we have the public health sector working with the veterinary public health and then even environmental health. Who should bring all of these different stakeholders together?
Well, who should bring them together? I think anybody, within your jurisdiction, anybody should be able to take that initiative, but just that the approach is not a unisectorial approach, because as you mentioned, we have humans on one side, we have the environment, that is maybe choked gutters, putting refuse at the wrong place, which is creating breeding grounds, or not weeding when it should be weeded. And then we have also, from the animal perspective, trying to control the mosquitoes, as you said, maybe breeding ones which can sterilize others. So that's collaboration, but who should take that initiative? It can come from, I can't sit here and tell you, it should come from us as members of this country, so whichever community you find yourself in, and you're a public health person, of course we can't do everything, but how can we get maybe your district assembly to look at malaria within that community as something that we want to deal with? You see, malaria is, for me, malaria, that's why I asked, is it curative or preventative? Yes, whilst we have it, it's good for us to sleep under mosquito nets. But beyond sleeping in mosquito nets and spraying our rooms every day with chemicals, what are we doing about the environment? What are we doing to control mosquitoes? I think there was a project on this indoor residual spraying, am I right? There was indoor residual spraying that some of the mining communities were taking, were implementing in the mining areas. But apart from the mining areas, those of us in the city, did we ever benefit from that? We don't know. So it's an open question to all, really.
Yeah, thank you very much. So I'll take another question, and then I'll take a few others, and we can wrap up here. So Patrick Labby Deborah says, data sharing should be one of our priorities. We shouldn't politicize, it, and so it's, I'll be playing to the public gallery, basically. The question is, should there be a policy here? I think, should there be a policy requesting government to equip and use data solely? I'm not too sure whether that's what he meant.
Should there be a policy requesting government to use data?
To use data solely.
Solely?
Yes.
Absolutely, government should use the data. Otherwise, what are scientists working for? Scientists produce the evidence. Government, I think, should use that evidence to inform policy. So they should, and that is based on data, gathering the data. So yes, government should listen. Humbly.
Yeah. Yeah, thank you very much. And I think Dr. Mofa has provided more information too. So in terms of the coordination, the district chief executives at the district level are responsible, and they usually will have the responsibility of bringing all staff together for health of the people in the district. So that speaks to the question on coordination, who should be responsible?
Exactly. No, he said the district, I think it should be the district health officer, is the one to get the district coordinator to understand that there is an issue. I think the onus, because they are more looking at the political issues. I think you all understand. So any district health officer should actually play that proactive role of being on his or her toes and having that interaction with the political heads in the districts. That these are the things you need to look at. Yes.
Great. Yes, so thank you very much. I have my last question. And my last question is, so when we go into Kumasi, you will see people sell pangolin and other animals.
Thank
my
you.
question is, when COVID came up, pangolin was one of the culprits.
Yeah.
Is it that the pangolin in that part of the world is different from ours and does carry the virus? Or, I mean, I'm trying to understand why we haven't had instances like this until recently when pangolin was the culprit.
The thing is, these spillovers, sometimes they happen all of a sudden. You know, we have pangolins in wherever, Asia, we have pangolins in Africa or Ghana for that matter, not just pangolins, but so many other different animal species that we harvest and we don't even allow them to grow to be, you know, adults and breed before we harvest. But as to whether, like before the COVID, we were not having issues with corona or whatever, we're not saying specifically that pangolins have the, what do you call it, SARS-CoV-2. They do have corona under normal circumstances, but just that once in a while you get a genetic shift and you get a strain which is not what you deal with on a daily basis. So maybe we've just been lucky, or even possible that we having some, you know, small deaths here and there attributed to interactions with wildlife, but just that because we're not looking, we're not seeing that statistics. Please, are you with me?
Yes.
Yes.
Interesting.
Once in a while, you have a strain of corona, even influenza viruses. We have it with us all the time. But once in a while, you get a strain which is extra potent or more pathogenic, and then you have flares, you know, sporadic flares. So that's how it happens. It's not something that is ongoing all the time.
Okay, no, great. Thank you very much. So looking at our chat box, we don't have any further questions here. We have great thoughts on the way your presentation went. People thanking you very much and very appreciative for the presentation. So I think we should be wrapping up pretty soon. So first of all, I would like to thank you very much for taking your time to give us this massive information education on what a zoonosis, how they interface with pandemics. I think for me, I have particularly learned a lot of things, and the fact that One Health, One Medicine, One World approach is one of the way to go to be able to address some of these pandemics we see. And it's something that you are moving, you are spearheading very strongly. It's a great thing. We have learned this evening a lot of things around what zoonosis are and then what pandemics are. And we have different categories of pandemics. We have the very severe ones who would cause more mortalities and morbidities, and then the lesser ones, they may not have a wide geographical significance. But then they are still pandemics, and then they cause a lot of problems. I am particularly interested in, and I was very happy to learn more about the research capacity, which has been something that every country has been looking at our response vis-a-vis the the severity of the event. And as a country, I think generally we are doing very well. We have heard a lot of the news. At the moment, our interventions are going down because of the severity of the problem. So I think this evening has been a great evening. We have learned a lot, and this is a discussion that has to keep on going. We need to continue this discussion because we are not in normal times. And so once again, I would like to thank everybody for this opportunity. I'd like to thank everybody for participating. The first timers, we thank you very much for being part of us. And we want to encourage you to continue to participate in these sessions. Very thoughtful sessions, very informative, things that can help all of us as a country to move and improve our indicators. So thank you very much, Dr. Lopes, for your time. Thank you very much for everybody for supporting me steer this particular session to a successful end. Thank you, and I'll hand over to James. Thank you.
Thank you very much, Mr. Kwara, for sharing this presentation. Dr. Mufa has an announcement. He will give us those announcements. When Dr. Mufa is done, I will kindly ask Elizabeth Hammond to give us a closing prayer. So please, Elizabeth, please be on standby. After Dr. Mufa's announcement, you will give us a closing prayer. Thank you.
Yeah, so thank you. Let me take the opportunity to thank you all for having me, and apologies for the technological challenges at the beginning. Thank you.
No problem, no problem. It's part of us. We understand we are, and we are growing. Thank you so much, Doc. At very short notice, I asked you to prepare, and you have actually.
Please, Dr. Mufa, we can't hear you. If you can. Okay, he's gone off. I'm hoping that he comes back now.
Yeah, I think he has challenges with his.
Yeah, he's gone off. Okay.
Technology.
Yeah, technology.
Yes. I mean, technology is always like that. Just a quick announcement. Around the end of this month, we will have another scientific session, very interesting. It's going to be mobilizing resources for public health interventions. I mean, all the things we've talked about, Sika Emoja, the type of things. I mean, we may be living in a pool of funds and other things, but we may not be aware or whatever. We are going to get an international
Dr. Mufa is gone. I hope he can.
Sorry.
Okay.
We are going to get an international expert to treat us to this particular topic, and so I hope you should be expecting something like that. So thank you so much, and take over, Madam.
Thank you very much. So thank you very much for coming. I want to say thank you. Even as of now, we have about 40 participants still joining. Once every thank you.
Hello.
Yes.
Yeah, this is Michael Nyavi. I just want to know, last time we complained about participation certificate, and you said you do something about it. How far may I know if this one will be getting something like that? Thank you.
Thank you, Michael. Dr. Mufa has gone off, but what I can say now is that, okay, Dr. Mufa is in.
And we will discuss it. Yes, we will discuss that, and we will only give it to those. I mean, if even we agree to go, we only give it to those who stay to the end. Yes, and so that's basically what I will say now. But we will discuss it later on.
Okay, thank you. So, Madam Elizabeth Hammond, can you please give us the closing prayer, please? Okay, I'm not sure she can hear me, so let me do the closing prayer so we can go. I want to say a big thank you to God for your protection, for speaking to us today. We thank you so much for our resource person for helping us prepare and give us this presentation. Help us to be able to learn a lot from this as we want to stay healthy. Help us to be agents of change so we can help this world and those around us to live healthy as well. Please bless us and give us good night's rest and help us in the days ahead of us. Because we pray in Jesus' name. Amen.
Amen. Amen.
Amen. Amen.
Amen.
Thank you.
Amen.
Thank you.
Thank you all.
Bye, everyone.
Thank you. Bye.
Bye.
Bye. Bye.